Woohoo.
Thank you, Jason.
Okay, why don't we go ahead and get started? So welcome to the Work Plan Review Committee and for Thursday, May 7th, 2026. And usually Marcy does roll call, but I can do it if we need to do roll call.
Yeah, we should.
Okay. All right. Bianca.
Good morning.
Okay. Monica.
Yeah, good morning.
Melissa.
Good morning. I'm here, Council Chair.
Okay. Jason.
I'm here. Research Continuing Engagement Specialist.
Okay. Michael.
Good morning, everyone.
Okay. Sarah.
Good morning.
And John.
I am here.
Okay.
We also have
And-
Lonnie.
Oh,
Lonnie's
Lonnie's
also on the
here?
call.
Oh, I didn't see. Okay. Lonnie.
Good morning, everyone.
Good morning. And I'm Kathy Lewandowski, Chair of the Work Plan Review Committee. Okay, so first on the agenda is the approval of the minutes for March 11th, 2026. Has everyone had a chance to read them?
No.
Okay. I've never run across that, so John, help me out, or Melissa.
Well, we can put that, we can table that item until our next meeting, or we could take a vote. We'll make sure, Monica, that you get a copy of those minutes. It's entirely up to you. I don't think it makes a huge difference when it comes to the business of today's meeting.
Okay. Is it up to Monica? Or
Yeah.
me? Okay. You want to table it or go ahead and vote on it?
I'm okay either way.
Okay. So why don't we just go ahead and vote on the approval of the minutes for March 11th, 2026. Has everybody have any changes or corrections or anything or questions about the minutes? Okay. Let's go ahead and vote. All in favor of approving the minutes of March 11th, 2026, please say aye.
Wait a second. You got to
Okay.
call. You. It's so
Sorry.
weird. It's no. It's okay. It's
That's
totally
okay.
weird. It's a weird day today. You need to call for a motion to approve the minutes as written.
Oh,
for
that's
March
right.
11th,
That's
yeah.
right. Okay. Okay, so I'm calling for a motion to approve the minutes. Do I have a motion?
Yes, I will approve the minutes from the March 11th, 2026 Work Plan Review Committee as written.
Okay, Melissa, do I have a second?
This is Bianca. I'll second.
Okay. Okay. With the motion, all in favor of approving the minutes of March 11th, 2026, please say aye.
Aye.
Anyone say any no's? Any abstains?
I mean, if there's no change, this is Monica. If there's no change, am I allowed to say aye or should I just?
Yes. You can say
Yeah,
aye.
I'll say aye then.
Oh,
I just
okay.
wasn't sure. I mean, I know things happen, but I just wasn't sure what to do in that situation.
Yeah, it's a good one. Yeah,
Sure.
a good question.
That's all right.
Thank you. Okay, so the minutes have been approved for March 11th, 2026. Did I do that okay, Melissa? I'm
You
still
did great.
learning.
You did great, Kathy.
Okay, item number C on the agenda is the FFY 2027 annual work plan, the updated draft. John, it's yours.
Okay. Great. I'm going to sort of start things off and others are going to jump in as we go along. What I'd like to do, well, I know Bianca has a hard out at 10 o'clock. So I want to make sure we get through some things we didn't go through last time. So I will, I think, jump to goal area 3, if I can. I think we got through 1 and 2 last time. And I want to touch on 3 and then go back because there were some small changes made to 1 and 2, but nothing, I think, too major. Anyway, sorry, I know that's confusing. Under goal 3, which we have just sort of generically entitled community inclusion, we have 3 objectives, only 2 of which actually have activities under them. I'll explain that later, but I think probably everybody understands why that is. It'll make sense when we get there. The first activity, or the first objective is the council will support and strengthen self-advocacy network and other organizations across Arizona to implement community inclusion initiatives that expand meaningful participation opportunities for people with IDD and their families in areas such as education, employment, housing, and civic engagement. So the first activity under this goal is continuing our support for the Self-Advocacy Coalition. It's known as Arizona Achieve. It is a project we've been supporting for a couple of years now through the ARC of Arizona and the ARC of Tempe. The work on this project will continue. We are planning to renew the contract effective July 1st of this year, running through June 30th of next year. Excuse me. There are some slight alterations to what we are asking in the contract, one of which is that there be a greater focus on leadership development as part of this project. One of the things we keep hearing from our folks at ACL and AOD is that there needs to be a strong emphasis in our self-advocacy work on developing leaders, self-advocates who are leaders, whether that's in their local communities or at the state level. So we have asked the ARC of Arizona to improve or increase the amount of work that's being done as part of this grant in the area of leadership development. We have specifically asked them to put together some kind of project that can identify a cohort, whether it's 5 or 10, to receive some rather intensive leadership development assistance, and to work with other parties outside of the ARC to promote that. And that could be Diversability Incorporated, it could be Encircle Families, it could be a variety of other organizations around the state that have some knowledge and some expertise in this area. So we've just gotten their renewal proposal. We just got it last week, maybe early this week. And we haven't had a chance to review it yet, but we will be going over that. Actually, Marcy and Lonnie and I are going to be going over some of that stuff tomorrow and, picking it apart. If there are further changes that need to be made, we have time to do that. This is something that would need to be approved by the council at the June meeting, but we have some time to work with them between now and then to make sure that things are as we want them to be. You can also see that we are intending to increase the funding from the $60,000 that we have given them over the last couple of years to $80,000 next year. And the purpose of that is, one, to enable them to do more travel around the state and do more face-to-face training with self-advocates, but also to help compensate any partners they bring into the project that have not been involved in the past, because those partners are probably not going to be able to do the work at no cost. So that is the first activity proposed under this, and it is again a continuation of a project that we've been supporting for a couple of years now, just with some changes to it. Any questions on that?
Yeah, this is Kathy. So
Mhm.
when the council asks you to focus on leadership development, what are the outcomes they really want to see from this? I mean,
They specifically want to see that individuals with self-advocates are at a minimum applying for or running as candidates for positions in community organizations, city councils, county commissions, things like that, where they would play a leadership role representing the disability community. Ideally, they would actually secure those positions, and some of those would be appointed positions, such as members of the DD Council. Others would be things that they would be elected for. And there's no guarantee, of course, that if they run for an elected position, that they would be elected to the position. But there should be some movement, at least in that direction. In the best of all possible worlds, ACL, AOD, they would like to see many more self-advocates holding positions of responsibility in their communities or at a state level. We're fairly young, I guess, outside of the DD Council, outside of the DD Advisory Council that the division operates. There aren't a whole lot of opportunities. Like there are some. I mean, certainly many cities have commissions on disabilities. Jason serves on the City of Phoenix Commission on Disabilities. Tempe has a great commission. There are opportunities like that, but in terms of ADDPC promotion of that, we're still pretty young. So we're going to make it a requirement of the grants of the Arc of Arizona to start moving more in that, start moving self-advocates more in that direction. But we can't make any guarantees about what the outcome is going to be. We can only demonstrate that we've done everything possible to motivate them, to train them, and to assist them as they seek those positions.
I think that's great. I've always thought that would be a good idea, but I also see it as, excuse me, my throat. Sorry. So with the ARC working on that, that's great. But at some point, the next step would be finding someone that could help us to navigate, running for an office or trying to get in a position. Do you know what I mean? It's not simple like we fill out an application and submit it. There's a lot more to it. And so I would like to see if we're going to continue with the ARC, maybe they begin to talk to someone about what are those next steps so we can train people to be leaders. Then how do we help them in that process, filling out whatever requirements, going and getting so many signatures? What is it that, do we understand that process of getting on a council or something?
Right. And actually, that's one of the reasons that we suggested to them that Diversability Incorporated might be a good partner in this, because DAI operates the Arizona Youth Leadership Forum, which is obviously it's focused on youth and young adults, but part of the training that they include is training on how to actually seek those positions in the community.
Okay.
I don't think their sweet spot is helping adult members or adult individuals with IDD, but it certainly is helping teenagers, young adults understand what's involved and seeking out those opportunities. So I feel as though in the coming year, we're definitely taking a step in that direction. But I hear what you're saying, and yes, absolutely, we can build upon that. Self-advocacy, we all know, we keep saying it, every time we meet, self-advocacy is an eternal part of the work we do. It is a mandated part of the work we do. And we will continue to evolve our program to better support self-advocates and help them better advocate for themselves.
Okay. All right. Thank you.
Sure.
Any other questions?
Anybody?
Sorry.
Sorry. I guess I would ask either Jason or Sarah if there's anything more you want to add to that. You work more closely with AZ Achieve than I do. Is there anything more you'd like to say?
No, I think you covered it. I think there's always opportunities to join boards and join different things. Because I serve on a lot of different boards, and frankly, I'd like to get off some of those because I have other things I have to do, but nobody who wants to take a bitch. Anyway, so I'd like to hand that over to somebody else. So I can definitely guide people in some directions they need to be. Also, I think a key person I might want to reach out to is maybe Jennifer Longden, because she's asked me to do some different things too, but she has some avenues there that we could probably take advantage of, because she worked her way up through the system when she was on the Phoenix Mayor's Commission first, and then went all the way up to the legislature. So she would be a good mentor those people, and I'm sure she would be willing to do it as well. So and to actually look at elected positions and to see how to do that. Now it is challenging, and you have to be willing to lose, because you probably lose the first round, but you would get your name out there. Name recognition is key when you're talking about elected positions. So that's just my ideas. I don't know if Sarah wants anything she has to add, but that's basically what I have. So
No, I think you guys said it perfectly.
Yeah, Jason brings up a very good point, and he is an incredible advocate, an incredible self-advocate, and he adds immensely on the councils and commissions that he serves on. But in the state of Arizona, he is among a relative handful of people who can be counted on to do that. We're behind the curve here when it comes to self-advocates who have positions of responsibility and play a key role in making the voice of people with disabilities heard. So we need more. We can't just rely upon the same people to do everything, because, as he said, it can get overwhelming. So we recognize the need, we recognize the imperative to do more, and that's really where we're headed, I think, with this grants. So the second item, the second activity is a project that we are in the first year of funding right now with Dr. Tammy Bassford, who is affiliated with the College of Medicine at U of A. She's also affiliated with the Sonoran Center, and she's putting together a project related to supported decision-making training for healthcare professionals. We just received the report. Her project started a little bit late because of various timing issues with getting contracts approved through U of A last fall. So it didn't start actually until December rather than October 1st, as it would typically start. And as a result, her reporting is a little bit delayed. We had to give everybody a little bit of grace and allow them to report on their first quarter activities a little bit later than anticipated. So we've just gotten the first report from her, and we've not had a chance really to review it as a team. But this is an area where we think it's really, really important to focus some effort, to focus some resources. We know for a fact that despite the fact that supported decision-making has been approved, it is written into law in Arizona now, there are a great many people who do not want to recognize supported decision-making agreements, who do not want to honor them, who question the ability of people with disabilities, and in particular IDD, to make choices for themselves and make decisions for themselves. In fact, we get calls all the time from people who say, my doctor won't abide by my supported decision-making agreement. There are lawyers, there are others who, for sometimes legitimate reasons, they have to protect themselves. They're afraid of their own liability if they abide by them. But we need to do a lot more education. We need to do a lot more work with these professionals so that they understand supported decision-making is the law. They are covered, they are protected because the law says they are protected, so on and so forth. Anyway, Tammy has been a strong advocate for people with IDD for many, many years throughout her career. She understands supported decision-making well, and she is now endeavoring on this project to educate more healthcare professionals. And I should mention, I think we have in the past, but I'll mention again, this is not just doctors and nurses. She is also focusing on administrators, because healthcare systems are among the most resistant to honoring supported decision-making agreements. And so she is working on educating the folks who are running the hospital systems and running the insurance companies and so forth. So this is one that we intend to renew for another year. Same funding level, $35,000, and we anticipate that there will be some positive results. Now, we also recognize that a grant of this size, and especially the fact that Tammy is primarily working on her own, there are going to be some limitations. She's not going to reach everybody around Arizona. She's really it's really a pilot, and so we have to determine in subsequent years if we're going to continue to fund something in this area, or if we're going to somehow fold that into to some other effort. But we know that the need is not going to go away. we just need to see what steps we can take within these first couple of years to identify how we address those needs most effectively. I hope that makes sense. Any questions regarding that?
How are we measuring, how will we measure if it's successful, or what are the next steps after this year?
Well, there's a discrete set of deliverables related to this particular grant. Tammy proposed to meet with a specific number of healthcare professionals, the clinical professionals, as well as a specific number of healthcare administrators. She agreed or proposed to do a certain number of training sessions for them to participate in a certain number of conferences or webinars at which she would address this issue. So for the first year anyway, we will know if it's been a success, if she has hit those marks, if she has had those meetings and done those trainings. Moving into the second year, I think it's a little early right now because this grant won't end until September 30th, but I would presume that what we are going to ask for is an expanded number of trainings, expanded outreach to a broader set of the healthcare community, and some means of measuring how doctors or how all of these healthcare professionals have evolved their understanding and evolved their willingness to accept supported decision-making agreements in practice. And yeah, I don't know exactly how we're going to measure that. I think that's going to require some discussion, but at a minimum, we do understand that we need to do a lot more in the way of educating the community. And maybe what we ask for in the second year is, it's just not just, but includes her being involved with more conferences, meeting with more healthcare systems, and just expanding the scope of her outreach to the community. Probably not a very satisfactory answer. Apologize for that. Any other thoughts or questions?
Yes, Kathy, you are on mute, ma'am.
Yes, I just realized that. I think it's a good start. I think when we begin to see policy changes for these health organizations, that will be, I think, show impact,
Yeah.
when it becomes more of a requirement that they really, support decision-making kind of thing. But yeah, I think it's a good step. I think we're going in the right direction. Thank you.
Okay. And then the third activity under this objective is the more general supported decision-making training. As everyone knows, the council has been supporting the FDM effort since, I think, 2019. I believe that's when the first grant was made to Southwest Institute for Families and Children to start the process of educating people about supported decision-making and pushing for the passage of legislation. So it's been a lot of years, and this is intended to be the final year of funding in this area, at least for the time being. Now, once again, we recognize that supported decision-making is still sort of in its infancy in Arizona. There's a lot of need for education. There's a lot of need for outreach. There's a lot of need to help both advocates and self-advocates, caregivers, and professionals understand what it is and adopt it. But we also recognize that the council can only fund an effort for so long. So I guess I would say we are open to revisiting this notion at some point in the future, but for now, we are planning to fund the project led by the ARC of Arizona and Disability Rights Arizona for one more year, with the stipulation that they need to be doing more, just like Tammy is focusing on the healthcare community. The ARC and Disability Rights need to be focusing much more effort on professionals, especially legal professionals and financial professionals, where we know, again, there is resistance to supported decision making. There is resistance to individuals with IDD making decisions for themselves. So we are keeping the funding level for this project moving into fiscal 27. We have asked them to continue outreach to individuals because we want more people to utilize supported decision making agreements, but we want a greater percentage of their time focused on professionals and the professional communities that continue to be sort of problematic in this area. There's going to be some overlap with the work that Tammy Bassford is doing. They are coordinating, though. Tammy serves on the state advisory committee for the ARCS project, so there's communication going on all the time. They're going to do as much as possible to limit their intrusion into what she's doing. But there's going to be a need for them, for the ARC and DRAZ to do some work with healthcare professionals as well. But we want to continue the momentum that has been built up over the last few years. We just don't see that we can fund any one issue forever. So again, the intent is for this to be the final year of funding on supported decision making. And we will need to have a discussion at some point in 2027 about what the council's role is around SDM moving into the future. Questions or thoughts?
I'm just thinking about how we can help the ARC continue with funding, not through the council, but there's got to be other opportunities out there to go to different organizations to get funding for this. I think it just has to continue, but it doesn't have to continue with us, but I do think it's important work, tell you the truth.
Yeah, no question about it. And we've had conversations with them about the fact that, that we're heading into the final year. And actually, we've had conversations with them over the last several years about the need to find alternative sources of funding for this. And I know they are looking. The director of the ARC of Arizona right now is very aggressive about seeking funding sources, and she's been very successful on some of their other projects. So I think they understand the need to do that, and they don't want to quit either. They've invested quite a lot in this. It's pretty central to their mission, I guess.
Yeah.
So I anticipate they will be able to find that funding.
Okay. Thank you.
Sure. Any other questions related to that? If not, I will move on to the next project, which is the Arizona Disability Collective, and I'm going to actually let Sarah talk about that.
Hello. So this is our effort to expand our base of self-advocates willing to speak to the media and provide, lived experience content for various blogs, videos. In addition, when there are advocacy opportunities to, maybe do a public comment, those can pop up. We are, growing our list for this speakers collective. We are working in tandem with Arizona Achieve. I wouldn't call this like an Arizona Achieve project, but it's like in line with all of the same goals and missions. A lot of the people who are members of Arizona Achieve are also on our list. And, this is pretty informal, but here's how this works, especially when we do outreach events. I'll give you an example. Our Lunch with Legislators series back in January that we did with the DAPA folks at the Capitol. We are just having natural conversations, really organic conversations with people who show up, who've already shown an interest in disability policy and disability issues, or maybe just as a person with a disability wanting to get involved. And we're basically just making that ask, hey, would you like to join this really informal collective? Again, it is not something that requires commitments to showing up to meetings, making it different than Arizona Achieve, but basically people we can call on when we need them. We are about to send out an ask to this group regarding sending in like images and content for our refreshed like annual report and website, it can be, this may sound strange, but it can actually be difficult to get stock photos of people with disabilities that are, I think, really well informed. Like there's always like the infamous stock photo of someone in a wheelchair, but it's like a hospital wheelchair. It's clearly not theirs. And you start seeing the same photos over and over again. So I'm about to send out an email to our collective to see if they want to contribute to that, making it real, making it Arizona specific. But that's just one example. So yeah, that's just a little bit about the collective. I'm happy to answer any questions that you may have.
I like that idea of the stock photos. Yeah. That's good. You're right. There are only so many stock photos of people, and usually they are in wheelchairs. So, yeah. Yep.
All right. And just to point out the obvious, this is a staff-led effort. This is not, there is no funding formally associated with this, so it's not, it is not a grant that we're making to anybody. It's something that Sarah really has the lead on. All right. Any other questions related to that? Not? On to objective 2. Annually, the council will strategically support community events across Arizona that promote meaningful participation, build connections, and strengthen the sense of belonging for people with IDD and their families in their local communities. The first activity under this is partnering with local entities to conduct events serving self-advocates and their families. I'll turn it back over to Sarah and Jason since they are the primary leads on this.
Jason, you want to go?
I didn't know it was me first. Okay, but yeah, we can so this is where we just put together events that people can go to and you know, make a list of people so that they know the events exist. You know, a perfect example of this, our intern created an event last when was that? Several months ago in the West. We put together that, and we were able to get the community out in that community to go and do resource fairs for them. So, and if we can connect people to those kind of things, or even build those kind of things with their interns, that's a plus. So, you know, and we'll focus more on that in our newsletters and different things as well, and just, you know, get the word out, you know, more. That's and Sarah could provide anything she wants to provide there. So.
We have been talking to some folks down at the Legacy Foundation in Southern Arizona, and they have told us we can have their brand new event venue that is made for like local nonprofits to use for free. Even though we're not technically a nonprofit, they've given us the go-ahead that we can use their space for a resource fair. So this would be in Sierra Vista, and we would be targeting entities serving the community in Cochise County. So that would include like Bisbee, Tombstone, Fort Huachuca, and that would be aligned with our efforts to try to get out more into these rural areas. And so, you know, having free venue space, that's actually really nice, and would potentially reach a lot of local nonprofits. We love to, you know, like that's what we're looking for. We're trying to figure out the best use of like the community resources so that people already know, oh, this is a entity in my community. I may not have heard of the council, but I'll come out to an event, and like leveraging those local resources. So
yeah. Also, if council members want to be involved as well, we definitely welcome that. So we will definitely announce this during the full council meeting. Something that comes to mind is we're going to Lake Havasu in September. That's another event that, you know, we were invited to. So it's about getting into the community, like Sarah was saying, not making the people come to us, but going to them.
shout out to Vijette. She's helping us out with that one.
So that's it.
Okay. Thoughts or questions?
Yeah, will we see a list of events if council members, could we put that out at a council meeting to let the council members know what events they might want to participate in?
We can definitely do
Absolutely.
that.
Yeah, thank you.
Make a note of that.
Okay. Great. The next activity is one that we are funding right now and in the process of discussing a renewal of. It is a project that Sonoran Center is doing related to training system navigators to support refugees with IDD. And Dr. Julie Arman is one of the leads on this. She was J.C. Farkas is also heavily involved in this. This is a project which related to a project that we funded recently to identify some of the needs, healthcare needs, and other support needs of refugees with disabilities in Arizona. They proposed they issued a report as a result of that. It was a really valuable project. They proposed to take a next step, which would help to train folks who can help those individuals who are refugees navigate the service system particularly in light of the fact that we're seeing cuts to refugee services at the federal level and at the state level. And they were looking for alternative ways of helping folks get the assistance they need, whether it's food assistance, medical care, transportation, you name it. So this project is underway right now. It is another project that was delayed as a result of those contracting challenges with the University of Arizona last fall. So we've just gotten the first report on it right now, and that is why we are not proposing to commit at this point to a second year of funding. We put it on the work plan because it's a possibility, but without being able to see what kind of progress has been made right now, we don't want to say that we're committed to it, or that we would ask the council to commit to it. We really want to have a chance to review what they've shared with us, and then kind of make that determination. We think it's valuable. We certainly think, again, that the refugee disability community is going to be disadvantaged by the changes that have been made. But the question is whether this project has been able to make any real inroads, whether they've been able to identify the people who could serve as navigators, who are willing to do it, how those people would be paid for. I know from conversations that I've had that there are potentially, even with Medicaid cuts, there are still potentially some Medicaid funds that could be used by nonprofit organizations or community-based organizations to help in this area. But once again, we just don't have enough information at this point to really to come to you and say we're recommending this for another year of funding. We didn't want to remove it from the work plan though, because it is still a possibility. So, questions on that?
No, I think what you're doing is a good move. It's a fragile area. A lot of people are not coming out. They're staying, I say kind of hidden just because of the way this administration is treating them. So I think what you're doing is good, that you wait and see at this point. It's just the timing may not be right now for continuing this project. So.
Right. So, Lonnie, you might want to jump in here. My understanding is that if we do not fund this for another year, it's going to leave some additional funds that we will have to find a way to commit in 2027. Is that an accurate assessment, Lonnie?
Yeah, but the award amount is so small. We're talking about $35,000. It's probably something that could be redistributed, or we could think about something else that could fill that, or potentially expand on another project that's doing well. But yeah, there's flexibility with our options. if we choose not to move forward with this.
Okay. All right. So then I think this is the last activity. Am I correct? Yeah, this is the last activity under this objective, and that is a Healthy Lifestyles pilot project. And I'll be honest with you, this is one that we are struggling with a little bit right now. We're all aware that that the IDD community faces certain healthcare challenges. In some cases, it's just access to healthcare. In some cases, it is the fact that people are too sedentary, that they don't exercise enough, that they are not as involved in their communities as they should be. I mean, we all, I think, have a good sense of the social determinants of health that that support an individual's well-being. And so we tossed around this idea of supporting what we're tentatively calling a Healthy Lifestyles pilot project and committing $100,000 to that project. Now we have a couple of ideas in mind. Once again, we're not at a point where we can state definitively what it is we want to pursue. We do think this is really important, especially once again in light of the cuts that are being made to home and community-based services, to other Medicaid services, and the fact that if certain things are taken away from people, something needs to be available to fill the gap. So we have an idea. We had an idea submitted by Yumi Shirai, who's with the Sonoran Center. She is involved with our Bridging Aging and Disability Networks project. It would be a way to utilize what's known as the Health Matters curriculum that was developed by the University of Illinois, Chicago. It would not be something new. It would not be something innovative necessarily, but it would be something that's never been tried in Arizona before. We looked over Yumi's kind of concept paper, and there's some things that would need to be changed pretty significantly in order for us to pursue that. It also is a little bit too limited for us to want to adopt it just as is. We want there to be broader outreach. We want to involve a greater range of organizations rather than just the Sonoran Center. And it's not a knock on the Sonoran Center. It's just that, there are other organizations like Ability 360 or other independent living centers, other nonprofit organizations, probably a variety of different players who could support this project. I know I'm talking a lot, and I'm probably not saying a whole lot, but what it all boils down to is we're still committed to moving in the direction of funding something. We just don't know what it's going to look like right now, and so we are working to try and have conversations with potential players, identify different ideas that could be introduced, and figure out what makes sense to pursue in this area. The goal is certainly to make sure that whatever we fund is going to have some outcomes. It's going to have some demonstrable outcomes that demonstrate the benefit to people of greater activity in their lives, greater community inclusion, that whether it's lower blood pressure, other healthcare indicators, or indicators of greater community involvement in other perhaps more nebulous, less quantitative factors related to social determinants of health. Probably all of the above to some degree would be included in this, but it's a little too early to know right now. We are open to entertaining ideas if anybody has any.
I don't necessarily have an idea of what to do with it, but I have a comment. And it's that I get that Healthy Lifestyles is focusing on prevention, right? But what I run into a lot in the disability community, autism is what I know the most, but other things is that there are so many co-occurring conditions that come with it. And this probably belongs under another committee or something, but first of all, accessing care for whatever that other condition is, finding somebody that understands you, that will listen to you as a patient and how you're feeling and what's going on and will take you seriously. I guess that's a whole other thing, but it goes in that health picture. I don't know if I'm making sense or not. A little bit. I see it with my own kids. Like, we're still on a journey with one kid who's had 2 neurosurgeries and another, and the autism piece, it's weird because the kid is hyperverbal. He's really smart, but because he's not really comfortable with strangers he doesn't know, but to communicate how he's feeling and what's going on to specialists, to doctors, to providers that he doesn't know, it's really a significant health barrier. So I don't know if part of healthy lifestyles has anything to do with advocating for yourself when you're in a doctor's office, even getting your checkup, right? I don't know if that has anything to do with it, but anyways, it's just a thought. So I'll be quiet now. I know Bianca has her hand raised.
No worries, Melissa. I think you make a lot of great points. And so I have a couple of questions. So I see the first one is, the outcome statement is services supporting refugees with disabilities and their caregivers. Is that scope, is Jimmy thinking about keeping it at that level of, that scope level of the refugee specific population, or is this something that could be expanded to other groups? That's my first question.
Well, if we're talking about activity 2, the refugee navigation model, the focus of that, not to say that it can't be expanded. I mean, we could learn a lot from that project that helps us to take it to a larger, to other populations or to the larger population. That is certainly a possibility. I think if we're going to, well, again, maybe it's too early to know because we have to see what the results of that refugee-based projects are, and then we can determine whether enough progress has been made to expand it for a second year. There's nothing that would prevent us. I mean, I think I get your point, Bianca, that probably everybody who receives state or federal services is going to need some help in this area moving over the next couple of years. So, this certainly could be something that goes to additional populations beyond refugees.
Thank you, John. And I apologize. I think I read the table wrong because I thought that the outcome statement for row 3 was, or for point 3 was above. I'm sorry if I'm not being clear, but so the outcome statement is under the line for number 2, but it actually belongs to number 2. Is that correct?
Yeah.
Okay. My apologies.
No, no
I
problem at all.
actually intended.
That's actually a great point. Thank you for bringing that up.
Yeah, no problem. I see that also for number 3 that the outcome statement is below the line. So it was a little confusing. But given that it's, I really wanted to talk about the Health Matters proposal. And just because I'm thinking it would be, talking about healthy lifestyles, and I apologize, I don't know much about, the actual curriculum that is being, kind of put forth as part of the proposal, but I could definitely see and hopefully a nutritional component as part of that as well, because I know that's one of the big challenges. I mean, I think about my brother who is now 30 and he is autistic, and I know, my mom who does the primary caregiving role, it's a big challenge to get him to make good choices in terms of nutrition, which, and, obviously plays a huge component in terms of his healthy lifestyle. And even getting him to the doctor it's only on his terms, and he's never had really any blood work or, dental because he refuses, and he's 6'2" and 240 pounds. And so it's very difficult to get him to, to obtain healthcare services. And so the nutritional component, I think, is really what's under the locus of control for my mom to at least, try to guide him to do, and make healthy choices. But, that's just something that I'm curious if there's that nutritional aspect, because I do think that a lot of families would be interested in getting more information on that and how to help guide their children, and just self-advocates as well as how do you make healthy choices in terms of food. A cultural component could certainly be included as part of that. I don't know if the curriculum has that, but these are just some ideas that I think would really, be be impactful in terms of developing this pilot project, and I think would certainly be helpful to include as well.
Yes, thank you for that. And I do want to say that as we've had these conversations, we have definitely talked about a variety of different aspects, and whether it's exercise or healthy eating, or behavioral health, or, as I said, involvement in community activities. There are so many aspects to the notion of well-being, and thank you for pointing out that a cultural component could be very important. I don't know that we have adequately addressed that. The Health Matters, I just to give you a little bit of a sense, the Health Matters curriculum, again, from the University of Illinois, Chicago, it is focused on using peer supports or using peer training. And so basically, if we went with that, the Sonoran Center, for example, would identify individuals who could be trained to then be peer supports or be peer trainers to other folks in the community who would benefit from a healthy lifestyles or a health and well-being training program. It's a long program. It takes about a full year to go through, and it has very defined set of lessons. And it has value. I think it has proven itself valuable in other places, but it doesn't necessarily meet the objective that we're trying to meet here in Arizona. I can't explain that any better than that right now, but it has some value. It's just not, we think, ideal for what we want. But what we are trying to come up with, I think, is exactly what you're saying, Bianca, something that takes into account all of the different aspects of living a healthy lifestyle or supporting the well-being of individuals. And we definitely should be taking into account the geographic challenges or differences, the cultural challenges or differences, the socioeconomic challenges or differences that people will face, because there is no, I don't think there's any cookie cutter approach that is going to work. So
Yeah,
we'll definitely, yeah.
And I was going to say, even on the, neurotypical side of, like social media, for example, you have nutritionists who will kind of push, yes, the Mediterranean diet is the gold standard for, healthy eating. And then, other cultural kind of foods like Mexican food are kind of, viewed as non-healthy. However, there's still a lot of really great healthy options within, Mexican food or Asian foods or different cuisines, just in general. So I think, that of course trickles down to, like you mentioned, different socioeconomic statuses, different cultures, different identities that would really benefit in a curriculum that focuses on health. If there's a nutritional aspect, focusing on, okay, how can you work with what you have, what foods that, your family cooks or your family likes, and making it so that they are, disability friendly and accessible. So I really think that, this program certainly, like you said, John, with the Health Matters curriculum, maybe it's not meeting, right now what we're looking for, but I certainly think that there's a lot of potential and a lot of need, and it could certainly be scalable if other partners are included, that kind of encompass a more holistic view of health. I think that not to, look down on the Health Matters curriculum, I think that that's a great start, and having peer-to-peer support is fabulous. And I also think that there's room for supporting caregivers and kind of looking at a family perspective, or even, providing trainings, Zoom, etc., in person. I think that all of those avenues can certainly, if this project is wanting to be fleshed out, those are different ideas that could make it maybe more, geared towards what we're looking for.
Absolutely. Thank you.
Of course. And with that, I'm so sorry. I have to head out. I have another meeting, but it's been wonderful. Thank you all so much for all your work. And please let me know when the next meeting is going to be.
Okay. Thank you, Bianca, for your thoughts. It was great.
Thank you. Okay,
I think this is a really, it's a good idea. It's complex though. There are just so many questions and things that need to be included that I'm glad you're calling it a pilot. If you do it, it seems like you'll have to do maybe a small sample to see how that works. You know, take one community, or I don't know if you'll focus on individuals with autism, or if you'll focus on, you know, individuals that are in wheelchairs. What is it? I just think it's a lot more complex than it looks on the surface.
that is exactly what we have found as we've discussed this, and we are going to have to. It is going to have to be pretty refined before we're ready to present it. And we also recognize that even though $100,000 seems like a lot of money, it probably is not for something like this, especially considering that we're likely to need multiple entities involved in organizing it and coordinating it. So, yeah, you're right. You're right. It's challenging.
Yeah, many states try to do, you know, this same kind of project just with the general population of maternal health women. And, you know, it takes a lot of people working on it just to get small results. So, yeah, I don't know. Melissa, you raised your hand.
I was just going to say that you know, like everybody here, I 100% agree on all points, particularly in everything Bianca said. Like, I so relate to that. And people in my community, and some, you know, the food thing, just making healthy choices. And if you've got somebody who's really picky, who's got sensory issues, and there is so much obesity in the disability community and in the autism community, I see too, because of the gravitation towards those foods and not wanting to move. And yeah, I mean, I know that we see that in the general population, but I do agree with you, Kathy, that this probably needs to be a pilot project, and somebody and maybe it is a targeted group. I don't know, but I think it's so important. But you know, the question is, how do you tackle it? So if there are partners or people out there who work with a particular group or really have an interest in this, that could design a pilot, I think, you know, I'm not even sure where to start with that, but it might be a way to go. You know, I don't know.
Sorry.
No, okay. I was going to say, I don't know if it's the health colleges at the universities, at like U of A. I don't know. I have no idea. Or local. We have medical schools here. I have no clue. Yes, Jason, I'll be quiet now.
I know that the Bodhi 360 has a cooking class that teaches some nutritional stuff, but that doesn't go, you know, too far. But that's a start. And I don't know if the Health Matters. I don't think the Health Matters curriculum focuses on. It focuses a little bit on nutrition, but it's more about peer supports and different things like that. I think it's good, but yeah, there's multiple layers here, because you have to find, you know, obviously it's a lifestyle change too. So you're not just talking about a certain period of time, and anytime you gotta do something that's, you know, that you're gonna do for a prolonged period of time. That's anytime you're working with people in general and trying to coach people on nutrition and working out. That's the whole purpose, is not just for, because you're gonna go back to where you were when you know, after you finish the program.
Yeah.
It has to ingrain. It has to be something that they can work with their whole lives, and like, because you can tell people not to eat sweets, but if they like sweets, then they're eventually gonna have to go back to sweets. After they lose a certain amount of weight, they're gonna, and sometimes it gets weight anyway. So it's a hard thing to tackle, because it's even a hard thing to tackle within the general community or population. And this community is a lot more picky.
Yeah. Well, the other thing you could consider is by age group. You know, in the general community, you're trying to start with the very young to have them think about eating and exercising correctly. So maybe this pilot would be with a certain age group, a younger age group, just to see if we can embed healthy lifestyles in a younger age group. I don't know. It's complicated, you know.
Well, we will continue working on this and not to jump the gun too much, but I'm hoping we can have another work plan review committee meeting before the June council meeting, because we need your sign off on what it is we're going to propose before we take it to the council. So by the time we meet again, we will hopefully have this fleshed out a little bit better. We will have something that that we can propose for funding for the next year. Okay. The last objective under this goal is a new one that's been imposed on us by ACL, and that is to have a disaster response objective. This is so interesting. Initially, and I think we may have even said at the last meeting, we wanted to have an activity under this because it seems kind of absurd to have an objective without some kind of activity, but we were later told that we're not allowed to have any activities under this objective. We are allowed to have activities related to this objective, but they have to be under a different objective. So anyway, we have this objective that we will collaborate with other emergency responders and first responders in the event of a natural or human-caused disaster, so that the disability community has the information and the resources they need. It's there, it's required to be there, but we had to move the activity to a different place. So, you know, maybe one of you can explain it. We can't figure it out, but that's the government in action, I guess.
It feels like it should be not part of what do I want to say, an objective. It's like you're reporting, well, there was a disaster and this is what we did, you know. That's how it feels like this one is, you know. But
yeah.
But the
Well,
activity, where did you put it under?
We moved it up under goal 2, and I can scroll up there now if you want.
Yeah,
Okay. Let's see if I can find it.
not this one.
Maybe we put it under.
Oh,
number
goal
1.
2, like oh, where is it? Oh,
Maybe we.
objective
Oh, there it is.
2.
It's under. No, I'm sorry. It's under goal 1.
Okay.
Objective 2, activity 5.
Okay.
And that is basically that we will build relationships and develop tools in advance of a natural disaster to ensure that we can work effectively with responders, response agencies, and get the information out to people who may need it. So some of this work is already being done. Sarah's got a relationship going with the Department of Emergency and Military Affairs, which has a division of emergency response or a division of emergency management, something like that. I'm doing some work with an organization down at U of A on heat response. I mean, we've got a couple of things going already, and this will continue to be something we work on.
What if
probably in perpetuity?
What if you just you reference goal 3, objective 3, and to show how they're related, or you know.
Oh, that's a good idea. We can definitely do that. We'll add in a note to that effect.
Yeah, that says in support of goal 3, objective 3, we're doing these activities, or you know, it's in related to it or something, so we understand why we have a goal objective 3 in goal 3.
Okay, great point. Okay.
Okay.
All right. So if you're all okay with it, we have about 20 minutes left. I'll go back up to the top and try and address some things that were changed slightly from our last meeting, but I don't know that there's anything really major. And other members of the team, please correct me if I'm wrong on that. You know, I think we just made some minor adjustments based on comments you all had at the last meeting. The data hub will be sustained. We are planning to fund Dr. Kurtz to continue expanding the data hub. And I have to tell you, we've had a couple of meetings with him recently, and he's shown us some fantastic new information that he's incorporating into the hub. Sarah is working on a public announcement of that new information and how it can be used by researchers and community members. I think it's really, really impressive what he's done, and it's going to be able to help us track trending over time. It's going to provide some explanations for why certain things have moved in certain directions, and it's a fantastic step forward for the data hub. So we'll be continuing to fund that into the next year. Mike is working with the governor's workforce cabinet, specifically focused on expanding employment opportunities for people with disabilities. Mike, do you want to talk about the resource fair or the event that's coming up in October? Employer forum? You're muted, Mike.
Yeah, thanks, John. As you mentioned, I'm working with the governor's workforce cabinet. I made a recommendation to have an in-person employer forum, and they liked the idea, so they adopted it. We're working on having an event on October the 9th at the Renaissance Hotel, and I was able to secure a moderator, Steve Kaiser, who was a former senator, Arizona senator, and now the chief executive officer of the Arizona Small Business Association is going to serve as a moderator. So I'm actively working with them, putting together this program. So we're looking forward to that. As it gets closer, I'll make sure that we send out invitations to anyone that would like to participate.
Thanks, Mike. And we certainly anticipate that working with the workforce cabinet is going to be an ongoing effort. There will be even greater opportunities, I think, coming out of that. Okay. I'm going to say that with the caveat that we don't know who's going to be in the governor's office starting in January, but we're hopeful that there will continue to be a push for workforce development in the state. And if that's the case, then we will certainly be involved in that effort. The Employment First initiative, I think everybody is familiar with that. Arizona is an Employment First state by executive order, and this is a key element of the work that Mike does to develop employment opportunities. So we will continue that. It's a staff-led effort and not something that requires funding. The Arizona Transportation Innovation Fund, Jason has been playing a key role in this to ensure that the needs of individuals with disabilities are taken into account. Now, one thing I do want to mention, I don't want to go into a whole lot of detail on this because we're still waiting for the fund to be established, but the Republican budget, the legislative budget that was just submitted to the governor and that the governor just vetoed, included canceling out the $2 million that had been appropriated for the transportation fund. So I would say that it's very much up in the air right now where that's going to land, whether the governor is going to ultimately agree to that, and whether it's going to be in the state budget moving forward. But the Republicans are willing to do away with it. The governor so far is not. And so we're going to keep it in the work plan. We don't know when or if the money is going to be formally made available. If it is made available, then that is something Jason will continue to work on, because transportation is a crying need for people with disabilities in this state. The Bridging Aging and Disability Networks project, funding for this ends at the end of September. So we will be starting a new fiscal year, continuing to work on this project, but without any formal funding to do it. That is not a significant issue in my mind, because all of the partners who are involved right now, whether it's Division of Aging and Adult Services, DDD, the ARC of Arizona, Arizona Statewide Independent Living Council, you name it, all of the partners have already committed to remaining involved. And basically what we're going to have at the end of this year is just a set of recommendations for moving forward anyway. So we'll continue to pursue some policy changes. We will continue to pursue trainings and education and outreach to communities around the state. And that is something that the focus on the aging community, I think, is something that will take on greater importance for us as we see individuals with IDD aging. You'll see in red here this new NAU IHD assistive technology pilot proposal. This is related to the bridging project. This is a new project that we've just added, and we're proposing to support a pilot using some council funds, using some funds from our Bridging Aging and Disability Networks grants, and using some funds from the Institute for Human Development at NAU to do a pilot where we would actually put technology into the hands of a cohort of individuals with IDD to test how they utilize it in their lives. And this could be various forms of technology. It's not everybody getting the same thing. It's all going to depend upon their particular circumstances. But we want to give them an opportunity to see how they can use particular types of technology. It could be really simple stuff like apps on their mobile phones. It could be more sophisticated stuff like sensors in their homes, kind of everything in between. But we've been doing a lot of work. One of the things that is really central to our work on the bridging project is how technology can support independent living over a longer period of time for individuals with IDD. So we want to see, now that we've hypothesized that it can, we want to test it and see, even with a very small group, what difference it makes for them and what lessons we can learn from that. So that is something we are proposing to fund starting July 1st of this year and running through June 30th of next year. In all likelihood, the project itself would be much shorter, but we fund things on an annual basis, so this would be something funded through the end of June next year. Health equity work is something that is just ongoing. It's staff led and not doesn't require any grant funding. I'm sorry, I'm kind of busting through all this, but any questions related to anything I've talked about so far? Kathy, I saw you sent hands clapping up the screen related to the technology pilot. Yeah, we think it's really essential that we do a better job. Arizona is way behind the curve, by the way, when it comes to providing assistive technology, really contemporary assistive technology. We're great at providing wheelchairs. We're great at providing some other mobility devices, and we're great at providing kind of lower tech things that people need, but we have done virtually nothing to provide true technological solutions for people, and we need to improve that. So
Yeah.
we're hoping this pilot will not only educate us, but will help us to educate DDD and Access regarding that need.
So are you going to, you'll train the individual and you'll train the family member so they understand it too, right? If there is a family member
Yes.
that helps. Okay. That sounds good.
Yes.
I like that.
This is Monica. When you're talking about assistive technology, I think computers need to be added to that, because
You
there
are
very
right.
it's hard to find computers for people with disabilities.
Yeah, and that's very much to the point, Monica. We are not providing some of the most basic things that people could use, things that are more sophisticated technology but are not necessarily expensive. We're just not providing them, and it's holding people back.
Yeah. Well, you need someone that can load the computers too with the assistive technology on them. I mean, we can give people computers, but if they don't have the apps on the software in there, then they're still not as helpful as they could be. Yeah. So.
Exactly. And then there needs to be other company, not just because people like Voc Rehab, they're like, you have to get a job in order to get a computer. But what if you need it for like your basic home budgeting or basic home grocery list?
Yeah.
Exactly right.
I'm not sure 25,000 is enough, but I mean, it's a start. But if you don't do another project, then move the money up there, I think. So.
Yeah, that is, I do want to point out that it'll be $25,000 out of council funding. There'll be another $10,000 from the Bridging Aging and Disability Grant, and then whatever remains in the budget will be provided by IHD from a set-aside fund that they have up at NAU some money that they need to utilize in the coming year. So,
Oh, good.
you know, the budget, it could end up being a $50,000 budget, but remember that we're talking about a really, a relatively small group of people. It's probably going to be 8 to 10 participants in the project.
Mhm.
And most of the technology that we're talking about providing is going to be relatively inexpensive. So, you know, I think we will have the resources we need to make it work, and that $25,000 is not the total of the funding that will be available. Okay.
And why
I want
not
to talk about
add,
this.
so-
Go ahead.
oh, I'm
Monica.
sorry, Mike. I'm sorry, John. But I was just going to add, why not invite people with disabilities who need them to say what, you know, to help research what's out there and what would help them.
That's exactly what we're going to do. And there's a work group focused on this already that includes people who work for the Arizona Technology Assistance Program, people who work for the Division of Aging and Adult Services, and some self-advocates as well. So they are having these discussions right now. And when we identify the participants in this project, we're very much going to focus on what they need. We're not going to tell them what they need. We're going to ask them what would be helpful to them and what they would like to test in their lives, so that we can see how successful it is for them.
Okay.
Okay. This Clemency Law Clinics pilot project is something that I think may have discussed last time. We have this idea of providing some funding to help individuals who are incarcerated, who are in state prisons, have assistance in going through the clemency petition process. We got some work still to do on this, and it's proving to be a little more complicated and a little more challenging than we thought it was initially going to be. So we don't have a whole lot.
It takes time to figure it out. So I don't know. It's complicated in a sense. I wouldn't say that, but we are having meetings about that. In fact, we're meeting tomorrow, or me and Marcy are meeting tomorrow. I'm working with and Kathy knows this because we're working with the criminal justice group, and DDD justice liaisons are part of that. And I think that's in fact, I just got noticed today that there's 180 people that they're working with through DDD, and 27 of those are actually incarcerated. So I think that helps us. Anyway, so just working through this and working, it's a combination of from when we started with the criminal justice work, the report, and from here. So I think we can actually get something done here. I've been really positive. It's been some really positive interactions within the last couple of days as I try to work with this. So there's I think there's some great movement here that we could help the community here. So that's what I think.
Okay.
Sorry, John. Didn't mean to
No,
interrupt.
it's okay. That's okay. Yeah, there are some wrinkles still to iron out, but we are having continued conversations on this, and so we'll have more to report by the next time we meet. Any questions regarding that? I think it's something that we may have shared briefly at the last meeting. The work around sexual violence, we are still trying to identify exactly what our support moving into the next year is going to look like. Sarah, please feel free to jump in if you have more to add on this. It is work the council has supported since 2018. It is work that is very important. And if you saw the headlines recently about a hacienda type event that occurred in Maryland recently, you know that the issue of sexual violence and sexual assault against people with IDD has not gone away. There was an event almost identical to the hacienda incident that occurred and made headlines in the Washington Post this week. But what exactly this is going to look like, we are still trying to figure out. So apologies for the nebulous nature of this. We know the work needs to continue. We just need to identify who's going to lead it and what the potential funding might look like moving forward, if any.
I don't think I have anything to add, but we are actively having discussions on the future of this. We're staying on top of it, so stay tuned.
All right, the IHD online privacy and safety training. As we've shared in the past, we are planning to renew that for a third year and have just gotten the proposal and not had a chance to review it as a team yet, but we've just gotten the proposal. The results to date seem to be very, very good. So we're pleased with what's been done, and they've identified some innovations that they want to add into the program for the third year. And so we will be bringing this to the council for approval for renewal at the June meeting. Jason continues to work, in addition to the clemency work, Jason continues to work on things related to criminal justice. We talked about the emergency preparedness and response issue. The second goal, the DESP, the Direct Employment Support Professionals, or Disability Employment Support Professional. Sorry, I'm probably getting it wrong. Mike can correct me. We are planning to fund this project again for a second year. Mike, do you want to report on any of the progress that's been made to date on that?
Well, we did receive the first quarter report and they are on track. The second quarter report is going to be really important because that's going to tell us how many individuals have taken the CESP exam and have passed it. And we're hoping that they're reporting that 9 people are interested. So we want to just to make sure that those 9 people have indeed taken the exam. So we're waiting for the second quarter report, and then we'll be able to make an assessment about how to move forward.
Right. Okay. We've talked about supporting a project search site in the past. We continue to work on that. Mike is the key contact with the folks at the University of Arizona who run the project search program, I guess through the Sonoran Center. We're basically waiting for a site to be identified at this point. And there are 2 potential sites, one in Yuma, one in Rio Rico, I believe.
Yes, that's correct.
And okay, and so we're waiting for them to tell us which one is is the best candidate for the project. And I'm trying to think of what else is new here. If I'm missing anything, folks jump in. The Think College TA Center, Mike and Marcy have been working with Arizona State University to get this proposal finalized. I think we are very close to the finish line on that. Mike, you want to share anything more about it?
Sure. Krista Perajito from ASU submitted a proposal yesterday, so Marcy and I received a copy of it. I did a quick scan. It looks like, well, first of all, I think it looks like a solid proposal. It includes everything that we asked them to include in the report, include a proposal including a budget, a scope of work, and a timeline. They also included 2 letters of support. So I'll be reading through it thoroughly and then going over it with Marcy. And then I'll talk to Melissa about scheduling a Meaningful Careers Committee meeting to review it as well.
Okay.
Mike, how will they measure their success?
Well, that's a good question.
You don't have to answer it now, but could the next time we present, could you?
Absolutely.
Just curious how they'll measure success.
I can tell you one quick area is the ability to recruit the community colleges.
Okay.
Because we have NAU, ASU, Grand Canyon University, and then the University of Arizona Project Focus on board. But the real important component is to make sure that we have support from community colleges. And so far we are getting that support, but ASU is going to be leaning on them to join. And then also how many people are accessing the information through the Technical Assistance Center. if they're really working toward obtaining additional funding for it, because it's going to be a long-term project. So I
Mhm.
think those are some initial areas of to be able to evaluate that. Kathy.
Okay, okay, thanks.
Okay, we are right at the end of the meeting time, and I apologize for that. I don't know that there's a whole lot here that is going to be surprising. I do want to touch on this AT Bridge Assistive Technology project that NAU is doing, or that IHG is doing. We have some questions around this. We're a little unclear that I think the deliverables have not entirely been met, and we're not confident that they necessarily will be by the end of the contract period. And so we are having some deliberations about whether or not to fund this for another year. And so it's, I would say this one is a little bit up in the air right now. Lonnie, did you want to weigh in on that at all?
Not at this point. We did meet with NAU and discuss some of the challenges that they're facing, and it does sound like they're trying to pivot and potentially find some solutions. So we'll see what they come up with and if it's getting any traction and showing any further success. But yeah, it's definitely something we're keeping an eye on.
Yeah, it has proved harder than they anticipated to reach out to the high schools and secure the participation they needed. So if given that that's the case so far, if that continues to be the case, it may not be something that's really worth us investing in it. On the other hand, if they can identify a different approach that will be more successful, then maybe it's worth continuing. So we'll see. The self-advocacy work is something you're all familiar with. That will continue. We talked about supported decision-making and continuing that grants into another year. And I think we may have gone over, we've gone over all of these things. So apologies for going so quickly at the end there, but that is basically where we stand. There obviously are some areas that are not set in stone yet. And if we can meet again before the June council meeting, we will, I think, have a much more concrete picture of what the next year should look like.
Thank you, John. Any
Mhm.
other questions for John? Okay, we have one more item on the agenda, and that's the 27 to 31 state plan development process update. John, do you want to leave that for our next meeting, or can you quickly talk
Well,
about it?
I can tell you really quickly that we are done with everything. We are done with all of the community input. We received no substantial comments that needed to, or that would have necessitated us going back out for a second round of public comments. So we are in great shape. We obviously need to finalize the work plan for the year. We need to finalize all of the bureaucratic stuff that we are required to submit. The week of May 18th, we will receive the actual forms that we have to complete. But I feel as though we are in very good shape right now. I'm glad Marcy's not on the call because she might tell me exactly otherwise. But I think we are in very good shape. The wonderful thing is that HCL has condensed the paperwork that we have to submit. They've eliminated some of the fluff, I guess. So what we have to submit this year is going to be a little more streamlined and a little bit easier to complete and take a lot less of our time, I think. The key issue for us right now is getting the work plan completed and getting it approved by the council so that we can submit it by August 15th.
Okay, so the last item we need to discuss is our next meeting, which if you look at the June calendar, the full council meeting is on the 26th. It's a Friday. And the executive committee is on the 19th, also a Friday. So it looks like our opportunity should be to meet on June 11th. And from 9 to 10:30, or do you think it should be 9 to 11, John?
Well, that's going to be challenging because a number of us are going to be out of state at a conference.
Oh, okay.
So Melissa, Jason, Mike, and I will all be gone.
Okay. How about the 4th? Is that a better time? June 4th or? Or a different day. It doesn't have to be on Thursday. It could be a different day. Let's
Well,
check.
June 4th works for me. I won't speak for everybody. Melissa's nodding her head.
It would work for
Okay.
me.
Okay, good.
Okay. Great. All right.
Alright.
Well, then I will send out an invitation for June 4th at 9 a.m. also.
Yeah, and that's enough time for the other staff to finish what they need to on this work plan, right? Or,
We'll do the very best we can.
okay. Yeah, you guys always do. So I have no worries with
Okay.
that. So,
John, and I know you're really
Okay.
prompt about sending out that meeting invite, but once it's helpful to block it out on the calendar as soon as possible.
yes.
Okay.
When I'm in trouble, I'm like, oh God,
All
oh
right.
no.
I can do it right now.
Thank you. Hey, Mike, can you stay on for about 3 minutes do you have a minute for that? Literally 3 minutes, because I've got a client I got to go see.
I do, Melissa.
Okay, thank you. But I got to touch base with you real quick.
Okay.
Thanks.
Okay. All
Anything
right.
else?
I don't think so. So we will meet on June 4th, 9 to 10:30, or if you think longer, 9 to 11. Okay. And you'll send out
Okay.
the meeting notice.
I
I
will
want
do
to
that.
thank everybody for their input today. It was great.
And thank you, staff, for all that work.
Yes.
Holy cow. Yeah.
Yeah, you guys are doing a great job. Really appreciate it.
Yeah.
All right. So shall we adjourn this meeting?
Yes, ma'am.
All right. Thank you, guys. Have a good weekend.
Thank you.
Bye.
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 Jason,